I find sleep absolutely fascinating. It's something that we spend a third of our lives doing, and from an evolutionary perspective, it must be serving an absolutely vital function. Otherwise, it would be a complete waste of time. My name's Dr. Scott Kearney. My research is mainly focused on the relationship between sleep and mental health. So we've known for an awful long time that sleep problems go hand in hand with mental health disorders, but we don't really have a good understanding of what's going on in the brain that links sleep disturbances to mental health disorders. We've done a lot of work demonstrating that when people aren't getting enough sleep, they have problems regulating the emotions, and the brain networks that are involved in supporting emotion regulation break down. We use various types of sensors that we can attach to the scalp and the face, and the information that we get from those sensors allows us to determine the stages of sleep that people are in. So the sensors that we place on the scalp will tell us about patterns of brain activity during sleep, and using that brain activity we can link it to different psychological processes and understand what's going on in sleep. So rapid eye movement sleep, based on the name, is characterized by rapid darting movements of the eyes. So these sensors allow us to pick up on this information.
My name is Professor Lisa Henderson. I'm a developmental psychologist. Much of my sleep research over the last few years has used the kinds of technology that we have in the sleep lab here, but tried to apply it to understand how sleep influences different aspects of development in children. Children aged between around 10 and 12 can consolidate much more material during sleep than adults can. What it suggests to us is that children's sleep architecture is particularly tuned to protect and consolidate the abundance of information that has to be learned earlier in life. And one example of a study where we've been using wearables is a study that's been looking at the effects of smartphones and social media on sleep in Year 8 pupils. So this was a study that was actually featured in a Channel 4 documentary called Swipe. And we really pushed things to the extreme in this study. We banned smartphones and social media entirely for 3 weeks, 21 days, in a group of Year 8 pupils. And we revealed some really interesting results. So we saw that within the first few days, their sleep began to improve. We also saw that they got less anxious over the course of the 3 weeks. They were talking to their families more, they felt more socially connected, and their attention improved.
So understanding sleep's role in mental health is absolutely vital, because by enhancing that understanding and knowledge, we can use it to develop treatments and preventative strategies and new interventions to support people in brand new and effective ways. Many of our treatments for mental health are ineffective for a large number of people, so there's a real urgent need to develop new treatments. What we'd love to be able to do is to get equipment that we can use in people's homes over several nights, over several weeks, to carry out longitudinal studies and look at the relationship between sleep and mental health over a much longer period of time.
We're beginning to influence government policy. We're trying to understand the kind of device level features that need to be incorporated into smartphones to make them safer for children. And I came into sleep research fascinated by the neuroscience. And then I became a mum and had 3 kids of my own that were terrible sleepers. From an academic perspective, knowing how important sleep is for a variety of different outcomes, but then being in this world of being a mum with a child that felt absolutely helpless, that has really changed the course of events for me in terms of my own research.